If you have heard, Deion Sanders, the Jackson State Tigers football coach, just had 2 of his toes amputated.
Amputated.
Let's talk about it. Now, Deion Sanders, who is a former NFL player and also a baseball player, is now the Jackson State Tigers football coach. And recently, he just announced that he had 2 of his toes amputated. Now, as a foot doctor, you already know this piqued my interest. Like, what happened? What could have caused his toes to be amputated? In this video, we're gonna talk about it. We're gonna talk about maybe some of the risk factors or what could have happened. And I'm gonna speculate on some of the theories that I have. So stick with me and we'll get right into it. Now, Deion Sanders, or Prime Time, or Neon Deion, had something that he called, or they said, was a dislocated toe as well as an inflamed nerve. Now, a dislocated toe is very common, especially in athletes, people who are very busy, people who work out a lot or do a lot of running. And so what could happen a lot of the times is you could have a dislocated toe either in the great toe, like in turf toe, when you're actually active, or you could have a dislocated toe when you have a rupture of a plantar plate. The plantar plate is a thick fibrous tissue that essentially holds the toe down. Now, if you have a dislocated toe that it's in the lesser toes, what could tend to happen is that the toe hangs. It hangs up, it's not usually on the same plane, it'll sort of hang like this, and so it's dislocated, and a lot of the times they may have to repair that thick fibrous tissue that's at the bottom of their toe to help bring the toe down and get patients walking normally. Now, what are some of the symptoms that someone could have if they have a dislocated toe? Well, like I said, it's hanging up, it's rubbing on the shoe, it's causing some discomfort and just pain, and it's just annoying. So yes, that could be fixed. Now, in terms of an inflamed nerve, there are lots of reasons why a nerve could be inflamed. It could be trauma, it could be prior surgery, it could be anything that may have happened at any point that just causes inflammation of the nerve, where the nerve is swollen, there's constriction. Some patients may feel symptoms like numbness, tingling, burning sensation, pins and needles, things like that. All of that could be symptoms of an inflamed nerve. Well, in Deion Sanders' case, I'm not exactly sure what nerve was inflamed, what caused the nerves to be inflamed, at what point was the nerve inflamed, because apparently he initially had his surgery in September of 2021. So we don't really know what caused him to go in initially and have the surgery. If I could speculate based on the picture that we see, I would speculate that he probably had a plantar plate rupture or a plantar plate tear, and maybe he had a bunion repair, because this incision could be used for a bunion repair. It could also be used if they wanted to clear out that big toe joint. If he did in fact dislocate that big toe joint, that incision could be used as well, because that gives us access to that big toe in that area. So I'm not exactly sure what happened, but based on this incision in the picture that he put up, if I had to speculate, I would say perhaps he had a bunion repair, maybe he had a plantar plate repair as well. Or maybe he also had an inflamed tissue that wanted to be repaired over on that side. We don't know. This is all speculation, and HIPAA won't let us get into it. One of the things that you have to make sure to understand is when you're working with these little toes, the blood vessels are very tiny. They're very small, they're very tiny, so you gotta be very careful. So apparently, according to the write-up that was on ESPN, his toes were wrapped up, and next thing they started to change color. When you start to see a toe changing color, a lot of the time what's happening is they may be losing blood. So you know how when someone is choking and they're turning blue, they're changing color in their face and things like that, the same thing can happen to the toes. And so we want to be very careful. We want to make sure that when we're working with toes, especially for my other doctors, that we're paying close attention not to put the wrap too tight, to be very careful of the neurovascular structures. And it's not to say that the doctor did anything bad. It can happen to anyone, but it is one of the complications from having toe surgery. And now the toes start to turn color. Now again, we don't know what his prior history is, and if this could have been avoided, it would have been avoided, because he then went on to have multiple surgeries. No one really goes into the details of the multiple surgeries that he had. However, all it tells us that he had multiple surgeries. And he also mentioned that they thought they were going to amputate his toe and then his foot, or then below his knee. When those kinds of conversations are happening, We usually will have those conversations when patients may be suffering from peripheral arterial disease or perhaps even a blood clot. Let's talk about either of those. Peripheral arterial disease is a disease situation where the vessels are just not working as well anymore. They're either calcified or they're just clogged with a lot of junk. So like patients who have heart disease and things like that, because there's a lot of fatty deposits within the blood vessels, those are not only working in the heart, they can go to any vessels in the body. Now imagine and understand, the toes are very tiny. So if there are tiny particles or tiny clots or anything like that that's blocking that blood vessel, that prevents blood flow from getting to the tips of the toes and things like that. And so with peripheral arterial disease, they just don't have enough blood flow. They just don't have good flow. There are multiple factors and multiple risk factors like diabetes, kidney disease, smoking. All of those worsen the chance and increase the risk of having peripheral arterial disease. The next thing that they talked about was blood clots. Now, blood clots could happen for tons of reasons. If a blood clot is dislodged, one of the things that could occur is it could go into your lungs. Now, when it goes in the lungs, that's when patients will have a pulmonary embolism. Essentially, the blood clot is blocking a vessel in the lung that's supposed to help to exchange oxygen and help the patient breathe better and have oxygenated blood. Another place that the blood clot can go to is the heart. It can block the heart, the coronary arteries, and so now we can't get blood to the tissues that are of the heart, and now the heart is not working or part of it dies off. Another very risky result from a blood clot is a stroke. So this blood clot can dislodge from wherever and go into the brain and cause a stroke, because now it's blocked off the blood supply that is supplying a part of the brain. That's why people have strokes and can't move part of their arm, or they can't do certain things, because that part of their brain that was supposed to get oxygen through the blood got blocked off by that blood clot. And as far as the limbs go, the blood clot, wherever it is, can also dislodge and just go further down. Now, think about it. If a blood clot is going downstream with nowhere else to exit, especially in places like the fingers or the toes, now that tissue in that area is lacking oxygen. It can't breathe. It starts to choke. It starts to lose color, like we talked about in the face. Now the tissue starts to die. And that's when we start to have concerns. Are you going to lose this toe? Is the blood flow going to come back? We don't know. So that's probably what happened when he started having toe discoloration, and they were concerned and started talking about possible loss of toe, foot, or even the leg. Now, based on what is written out there, he had a femoral arterial clot. The femoral artery goes all the way from the top of the pelvic area and goes further down the legs, and it divides into other arteries and things like that. So essentially, there was a blood clot that was all the way at the top. That is probably why they were concerned, because if the mothership is blocked with a blood clot, how is the blood flow going to come down? Hence why they're concerned. Is this blood flow going to come to the toe? Is this blood flow going to make it through the foot? Is this blood flow going to make it to the leg? So luckily, it seems for him, he did have some blood flow down and he didn't lose his leg or his foot and lost 2 toes, but it's still devastating anyway. No one wants to lose a body part, right? In addition to all of this, he also had compartment syndrome. Compartment syndrome is a situation where there's increased pressure in a compartment. Think of it like, when you shake a Coke bottle. So what happens when you shake a Coke bottle is the pressure builds up, right? Pressure builds up and builds up and builds up, and then push, all of a sudden it has to burst. It has to go somewhere. Now, in the case of a body part, when there is compartment syndrome and there's increased pressure in a compartment, we have to think of some of the things that are in that compartment. In a compartment, you can have muscles, you have tendons, you have blood vessels, so you have arteries, you have nerves, and you have veins. So all of this is being choked up in a compartment. And now it causes severe amount of pain that is great, like just out of proportion. You can give all the pain medicine you want, it just does not get better. The only way that it gets better is if you release that pressure. So just like a shaking Coke bottle, the only way that pressure releases is if you remove the top of the bottle or it bursts out. Same thing with the in our body. You have to make an incision. You have to make a cut to let all of that pressure out and let things release. So he had these two things, which was the femoral arterial clot as well as compartment syndrome. So my guy went through a lot. It was a lot of situation, a lot of things that he was going through the surgery. So I really hope that he's getting taken care of now. I hope that now that he's talking about it, it's because he's completely healed. That's why we're having this conversation now. If he still has that femoral clot, one of the things that they may do is they may put him on a blood thinner. So that's another thing, because they want to make sure that that clot does not travel from his artery anywhere else. We don't want it to go to the heart. We don't want it to go to the lung. We certainly don't want it to go to the brain, for sure. So I'm sure they're gonna put him on blood thinners. They're gonna keep monitoring him. They're gonna keep a very close eye on him. I mean, it's a lot. It's a lot that he has going on. Hopefully he doesn't have other comorbidities like diabetes, kidney issues, end-stage renal disease, or, peripheral arterial disease like we talked about. So I don't know. What I do know is that hopefully if he does have all these diseases, they're managing it properly, and I hope he doesn't smoke, and best of all, I hope that he's really compliant with his doctor's orders. You see, I know that he was on the field, in his scooter, which is fine because he was probably supposed to be non-weight bearing, so he can scoot around, but we want to make sure that patients are following their doctor's orders strictly. He did mention that he was following his doctor's orders, and so the hope is that he's still doing that, and this was just an unfortunate situation that happened. So this was my quick overview and breakdown of what I think happened with Deion Sanders and his foot. If you have any questions, leave it down below or send me a DM on Instagram. It's also the Fly Foot Doctor, or on TikTok, it's the Fly Foot Doctor, and there you can get more in contact with me. But leave a message down below if you have any comments. If any of these things that I mentioned, you need more explanation about it, certainly leave a question down below or talk to me about it down here. Share this video with people who you think may enjoy it or like it. If you're new to my page, I'm the Fly Foot Doctor, Dr. Show. I'm a podiatric physician and surgeon practicing out here in Houston, Texas. If you want to see me personally as a patient, definitely go onto our website, www.DeNielFootAndAnkleCenter.com, and have our phone number. You can give us a call and book a virtual consultation, or come in and see me personally. And last but not least, if you're new here, would you consider subscribing to my channel so you see other videos that I might post? Also, like and share this video, and like I said, leave a comment down below. Till next time, it was great hanging with y'all. Have a great day.